We have a cervical part, C1 for C8, thoracic cord, T1 for T12, lumbar cord, L1 for L5, and sacral cord, S1 for S5, and finally coccygeal. We have a 31 pair nerves in the spinal. The end of the spinal cord, name coneus medullaris. Coneus medullaris, the end of the spinal cord. The end of the spinal cord, name coneus medullaris. After this, the shape of the nerves. The shape of the nerves. Quada equina. Quada equina. You see this. Same of the tail of the horse. Quada equina. This shape. شکل. اسب چی میشه تو عربی؟
حصان.
This name, quada equina. This formation from exit of the nerve in the spinal cord. The spinal cord formation, the flexus. You see this. This spinal cord in the transverse section. مقطع ارضی. مقطع ارضی. White matter, gray matter. ابیض اسود نمیشه. چی میشه؟
رمادي اساسي.
رمادی. Gray. Gray. These have a axon only axon. فقط axon. And this axon, precaryon and dendrite. In the gray matter. Gray matter have a two sections. One, anterior horn, posterior horn. Anterior horn, posterior horn. Anterior horn, motor. Posterior horn, sensory. And this name root. ریشه. Root. Root. Anterior root, posterior root. Anterior root and formation the motor part of the spinal nerve, and this sensory part of the spine. The spinal nerve have a motor and sensory fiber. Motor and sensory fiber. This DRG, dorsal root ganglion. Dorsal root ganglion. DRG. After this, you see this. This white matter. White matter have a two sulcus. Anterior sulcus, posterior sulcus. Ventral, dorsal. Ventral and dorsal. Ventral sulcus, dorsal sulcus. In the white matter, we have a three part. Anterior part, lateral part, posterior part. Three part in the white matter. White matter only for a tract, for a fasciculus, for a حبل. حبل المتين. Its name is vertebra. This region named vertebral foramen. Vertebral foramen, the location of the spinal cord. vertebral foramen. And you see this discs between vertebrae. Disc between vertebrae. The position of the spinal cord. This spinal cord and this meninge. And this meninge. We have a 3-layer of the meninge. Dura matter. Yes? Arachnoid, pia matter. Pia matter attached to the spinal cord. You see this. This spinal cord, this pia matter. This arachnoid. This dura matter. This subarachnoid space. Subarachnoid space have a CSF. CSF. The flexus. The flexus. 1 flexus, 2 flexus, 3 flexus, 4 flexus. C1 for C4 cervical plexus. C1 for C4 cervical plexus. C4 for T1 brachial. Brachial plexus for upper limb. Name axillary, median, أعصاب. Cervical plexus شبکه گردنی. گردن. neck. Brachial plexus شبکه بازویی. Brachial plexus. And finally, lumbar plexus, sacral plexus. Lumbar plexus for a lower limbs, for a quadriceps, for a adductor, longus, magnus, brevis. And major part of the sacral plexus named sciatic. Yes?
Yes.
Sciatic for hamstring, for muscle hamstring, for a 2 branch, tibial and pronaal nerve.
Excuse me, from where sacral plexus start?
Yes.
From what vertebra it start?
Start from L4 for S4. Sacral plexus. L1 for L4, lumbar plexus. L4 for S4, neck sacral plexus. You see this. This quada equina, the nerve for a spinal cord. The nerve of the spinal cord, name quada equina. You see this nerve. All of the nerve, S1, S4, S2, S2, S3, S4, parasympathetic of the pelvis. S2, S3, S4. Parasympathetic for bladder. Parasympathetic for a digestive system, canal anal, rectum. All are from S2, S3, S4. This name dermatoma. This name dermatoma. This dermatoma. This nerve C4, T2, T3. All of the body have a dermatoma. This for a sense. Yes. Is only for a sense. Okay, for example, C1, C4. But the name of the nerve, ulnar, yes?
Yes.
Median, radial, yes? This name of the nerve have a motor and sensory root, yes? motor and sensory. Sorry. Hello. Dermatomes. All of name dermatomes. This dermatomes. This spinal nerve and muscle innervation. Okay, about a sensory and motor pathway. Sensory and motor pathway. First, sensory motor. We have two model of the pathway. Masir, in the Arabic, pathway. Ra. Pathway. Saudi, Nuzuli. Yes? Ascending, descending. Ascending have a sensory. Yes. In the spinal cord, go to the spinal cord, go to the spinal cord, go to the yes, to the brain. Honest? It's better. Air conditioner. Ascending from a spinal cord, go to the brain. Ascending. Descending.
From the brain to the...
Yes, for the muscle, for this motor. This motor. Two pathways. First, ascending. You see this. This is a spinal cord. A spinal cord, we focus in the white matter. Focus in the white matter. In the white matter, we have a tract. For example, gracilis conatus. Gracilis conatus for a proprioceptive sense. Proprioceptive sense. Gracilis conatus. Proprioceptive sense. Gracilis for a lower limb, conatus for a upper limb. For vibration, in the earthquake, zilzala, zilzal, this vibration sensed by gracilis and conatus. Vibration your cell phones, okay? Gracilis and conatus. And spinocerebral. Spine نخاع. Spinocerebral for a coordinations. For تعادل. Spinocerebral مخ. از نخاع به مخ. Spinocerebral. Anterior spinocerebral, posterior spinocerebral. Spinothalamic. Spinothalamic. From spinal cord, go to the thalamus. Spinothalamic. Spinothalamic for a pain, temperature, pressure, touch, all of by spinothalamic. All of by spinothalamic. We have two spinothalamic. Anterior spinothalamic, lateral spinothalamic. Anterior spinothalamic for a touch and pressure. Lateral spinothalamic, pain and temperature. Pain در فارسی میشه درد. علم. Temperature دما. گرما. درجه حرارت. pressure فشار چی؟
ضغط
دقت نشد. And touch lamps. This by anterior spinothalamic, lateral spinothalamic. Sensory pathway. Sensory pathway, we have three major somatic sensory. Posterior column, gracilis and conatus. Spinothalamic, spinocerebellar. These three major pathways for a sense. For a sense. Hello. This region have a three neuron. This region, this pathway have a three neuron. One neuron in the DRG. DRG. One neuron one. Okay. Alright. Dendrite, neuron, axon. Yes. Neuron one in the DRG. After this, neuron 2 in the posterior horn of the spinal cord. Posterior horn of the spinal cord. You see this. Neuron 1, neuron 2. And neuron 3 in the thalamus. Thalamus for promote of the messenger. Promote, relay, amplification, تقویت. Yes? تقویت پیام, تقویت message. Huh? Yes. In the thalamus. And understand of the message in the brain. Understand which message? Pain, temperature, in the brain. Which region of the brain? Post central gyrus. This region. This name post خلف central مرکزی. Gyrus شکنج. Gyrus sulcus شیار ها. Gyrus برآمدگی. Dumb shape. Gyrus and sulcus. This gyrus, post central gyrus, not see there your cell phone. You have a class. You have a class. You fail, I cry, I appear. See the cell phones. This time for class. And finally, false. Flus. This for you, not for me. This some of the students know. Huh? Your friend is no. Wake up. No time for cell phone, no time for break. This for class. Some of, not all of. Some of the pathway have a decussation. Decussation cross from left to the right. This name decussation. From right to the left. For example, touch, vibration, pressure, proprioception, sensation, this region. This by gracilis and conatus. This region for gracilis and conatus. Neuron 1 in the DRG. And go to the posterior horn. And by gracilis, go to the medulla. Basalon nocha. Basalon nocha. Neuron 2, in the medulla, and neuron 3 in the thalamus, and neuron 4 in the post-central gyrus. These have a 4 neurons. 4 neurons for a sensation and understand this fine touch, vibration. This by gracilis and conatus. Gracilis and conatus. This tract name medial leminiscus. Medial leminiscus. Medial leminiscus, the tract for a gracilis and conatus. This tract, this highway, tariq. This name medial leminiscus. This touch and pressure by anterior spinal cord. Neuron 1 in the DRG. Neuron 2 in the posterior horn of the spinal cord. Decussation in the left to the right, name anterior spinothalamic, and go to the thalamus. Thalamus have a nucleus, same of the egg. Thalamus, same of the egg. Yes? Egg of the judge. Same of this. And finally, understand in the post-central gyrus. Pain and temperature. Pain and temperature. Neuron 1, DRG. Neuron 2, dorsal horn of the spinal cord, decussation, and lateral spinothalamic, thalamus, and finally in the post-central gyrus. For a understand, you see this, for a lips, these regions, for a face, for a finger, for a all off in this region. This spinocerebellar. Spinocerebellar. You see this. This spinal cord, proprioceptive input from this for a muscle. A spinocerebellar for ta'adul. Yes, ta'adul act by muscles. Yes, act by muscles. You state by muscle. Yes, this message from this region, neuron 1, DRG, neuron 2, posterior horn of the spinal cord, and posterior spinocerebellar go to the cerebellum. But anterior spinocerebellar have a 2 decussation. 1, decussation in the spinal cord, in the left go to the right, and go to the pons, after the pons decussation, and go to the cerebellum. Posterior spinocerebellar for a lower limb, anterior spinocerebellar for a upper limb. This is very important for a balance, for a coordination, for a walking, for any movement. These all of the pathway, the first, second, and third order, and final destination, and site of the crossover.
Is this important in the final exam?
Yes, all of important, but you are not studying.
I mean this pathways.
Yes, this is very good. This very good for a study. Yes. Motor pathways. Motor pathway. We have a sensory pathway, motor pathway for a skeletal muscle contraction, انقباض, for a movement, for a harakat. These have a two, a skeletal muscle contraction and for a sympathetic and parasympathetic. Parasympathetic motor function. ترشح البزاق. Salib. Salib in the Arabic?
لعاب.
La'ab, yes, in the oral.
Yes.
In the Farsi, buzaq. Maye buzaqi. For eating, yes?
Yes.
Liquid, this thing. This parasympathetic function. This product by these regions. This parotid gland, submandibular gland, sublingual gland. Three glands for productive la'ab. Yes?
Yes.
This controlled by parasympathetic.
Like the ingestion in the stomach.
Yes. But you have a sympathy, you have a fear. Jobn, tars,
خوف.
khawf. You have your salivary is American. Your mouth is dry. Yes, in the sympathy. This not product this liquid. Motor pathway, cortico-spinal pathway. Cortico-spinal pathway. Cortico-spinal pathway. We have a two pathway. Cortico-bulbar in the brain to the brain. Cortico-bulbar. What cortico-spinal? Yes. This for a movement. These roots have a two neurons. Upper motor neuron in the CNS, lower motor neuron in the spinal cord. You see this. This brain, this upper motor neuron in the region named primary motor cortex. Primary motor cortex. All of the motor cortex, turn off your cell phones. Primary motor cortex region in the precentral gyrus. This sensory, this motor. Okay? Precentral gyrus. The region for a primary motor cortex. This neuron 1, neuron 2. Neuron 2 in the spinal cord. Which region of the spinal cord? Ventral horn. Ventral horn motor. Dorsal horn for a spinothalamic, gracilis, conatus, spinocerebral, but ventral root for a movement, for a harakat. You have this, go to the skeletal muscle, go to the skeletal muscle. This region for a visceral, this for a sympathetic and parasympathetic. Neuron 1 in the hypothalamus, neuron 2 in the these regions. Autonomic and go to the preganglionic neurons. After the spinal cord. This cortico-spinal root, you see this. Start these regions. This name cortico-spinal. For foot, for leg, for thigh, for an arm, for hand, for face, for larynx, anjara. Okay, start this and go to name corticobulbar. Formation the cerebral peduncle and go to the basal nakha, medulla, and formation the pyramids. Is have a decussation in the basal nakha, taqatu. In the left, go to the right. This name lateral cortico-spinal. This for a movement. Lateral cortico-spinal. Some of the fiber formation the anterior cortico-spinal. This not the decussation. These are for skeletal muscles. This anterior corticospinal and lateral corticospinal, reticulospinal, pectoraspinal. All are formation for movement. Okay. The region in the brain name basal nucleus. Basal nucleus for modification of movement. For example, in the ballerian, in the dancer, okay, you have this not good movement, yes, but basal ganglia, this, okay, modification for movement. Modification for movement by basal ganglia. Basal ganglia lower the brain. This motor cortex and basal nucleus. Caudate, putamen, globus pallidus. This name of the nucleus. Yes, this name basal ganglia for modification of the nucleus. These are of the, yes, corticospinal pathway, neuron 1, neuron 2, and neuron 3, and finally, head. This shape of the brain. This shape of the brain. Yes. Brain have a frontal lobe. Frontal lobe. And this region named parietal lobe. Parietal lobe. Temporal lobe. And finally, occipital lobe. Frontal lobe, this region. This for tafakkur. Tafakkur al-ameen. Qazawa. This for this region. This for a frontal lobe. This region have a central sulcus between frontal and parietal. Post-central gyrus for a sensory. Yes? All of the sensory go to the primary sensory. Post-central gyrus. And this region, primary sensory, primary motor cortex, or precentral gyrus. All of the act start this region. All of the act. This region in the temporal for a auditory, for sam, for ta'adul, and occipital for a visual. رؤية عينين لسان شفتين This occipital for a visual cortex. This for a parietal for a sensory, this for a motor, and tafakkur. This name lateral sulcus. We have a major sulcus, central sulcus, lateral sulcus. This major sulcus in the brain. This gyrus, this sulcus. Gyrus and sulcus. This region for a prefrontal. Prefrontal for your personality. Okay? Personality by prefrontal. Not good. Prefrontal majnoon. Yes. Prefrontal. And this region for a speech. Yes, this name Broca. Broca. This region for Broca for a speech. This name by Brodmann. Brodmann name of the scientist name the region 1, 2, 3 all of the brain name. You see this. This for a this structure. استراحة 5-minute break. And somatosensory region for a sense and motor. This region, precentral gyrus, postcentral gyrus. Precentral gyrus for a motor, postcentral gyrus for a sensory. This sensory and motor region for this. For example, for leg, for hips, trunk, neck, head, arms, and all of the structure. This spinal cord and brain. A spinal cord blood supply. The name of the blood for a spinal cord name vertebral artery. Vertebral artery. Vertebral artery, you see this aorta, okay? This descending aorta and these two common iliac. You see this, the name thoracic radicular artery. Great radicular artery. Anterior spinal artery. Posterior spinal artery. This for a spinal cord. For a brain, basilar artery and common carotid artery. Basilar and common carotid artery. You see this. This ventral, this anterior spinal artery, is for a spinal cord. General organization of the motor system. 1. Cerebral cortex for a spinal cord, for a brain stem. This corticospinal, this corticobulbar. 2 root. Yes. For a sensory, go to the cerebellum, bones, thalamus, and finally cerebral cortex. This ascending, this descending. This difference. You see this. The region of the spinal cord, anterior horn. Yes, for a medial motor systems and lateral motor systems. This shape of the gray matter and white matter. This lateral spinal corticospinal tract. for a skeletal muscles. For a contraction, these have an upper motor neuron and lower motor neuron. Two motor neurons. Internal capsule. Internal capsule, the fiber between thalamus and post-central gyrus. Internal capsules. You see this. This shape of the brain. The next class about this. This lateral corticospinal, you start this region and finally go to the anterior horn of the spinal cord. This lateral corticospinal is very important. We have a two corticospinal, anterior corticospinal, lateral corticospinal. And robospinal. Robospinal related to the midbrain. And go to the, in the lateral, go to the anterior horn of the spinal cord. This for a movement. Vestibulospinal, from vestibular nucleus to the spinal cord. All of this name descending movement. Autonomic system. Autonomic system, two parts, sympathetic, parasympathetic. Sympathetic only in the T1 for L2. Sympathetic only in the spinal cord. Which part of the spinal cord? Lateral horn of the spinal cord. In the segment of the spinal cord. The spinal cord have a anterior and posterior, yes, or this anterior, this one. In the T1 for L2, this have a lateral horn. Anterior, posterior, lateral. Yes. Horn. This only T1 for L2, only for a sympathetic. For parasympathetic, two parts. Parasympathetic S2, S3, S4 in the spinal cord, and some of the cranial nerve. 3, 7, 9, 10. 7 name oculomotor. 3 name oculomotor. 7 name facial. 9 name glossopharyngeal. 10 name vagus. This parasympathetic. You see this. Oculomotor, facial, glossopharyngeal, vagus. Vagus parasympathetic. S2, S3, S4 only for parasympathetic in the pelvis. For bladder, for rectum. For bladder and for a rectums. This some of the pathology about the upper motor neuron and lower motor neuron. If upper motor neuron is a trauma, all of the body have a paralysia. Paralysia in the Arabic, falaj, shal,
شلل
shalaj,
شلل
shalal. In the Farsi, shal. If for a lower motor neuron, only this region. Upper is a very important. This all of the pathology for a upper and lower motor neuron. This all of the pathology, this not related to the other class. Okay, this finish for a class. Next class about